get started.
Welcome to the Financial Purpose Podcast. All opinions expressed by me or guests of the podcast are solely our own opinions and do not reflect the opinion of Life Moves Wealth Management. This podcast is for informational purposes only and should not be relied upon for any investment decisions. Clients of Life Moves Wealth Management may maintain positions in the securities discussed in this podcast. Welcome to the Financial Purpose Podcast. This is episode 60. Josh, 60 episodes. Crazy. 60 episodes. Today, we are going to have a lot of fun. I have two very good friends and special guests on the podcast, and we're going to talk about all things Medicare related. So if you're 30 years old, this episode is not for you. But go ahead and listen because your parents are probably old enough for Medicare, and we want to get good information to them as well. So let me introduce my good friends sitting in front of me. Lauren Dessa sitting opposite or next to Lauren, opposite me, diagonal from me. I don't know my directions.
We'll go with that.
Is Hector Dessa. So, guys, welcome to the podcast.
Thanks. Glad to be here.
Yeah, thanks so much for coming on. So tell us a little bit about who you are, what you do, how long you've been doing it, why you like it, all that fun stuff.
Ladies first.
All right, I'll start. So I've been doing Medicare for about 7 years now. Started in 2017. What did you want me to say? What I like about it?
Yeah, I mean, just of all the things in the world, why Medicare?
Yeah.
Right?
So, I mean, honestly, I kind of fell into it. I was a personal trainer in my prior life. And one of my clients happened to have this schedule that he could meet me at random times. And I said, what the heck do you do for a living? He told me a little bit more about what he does and piqued my interest to help people that don't necessarily always have an advocate. This population of people get bombarded left and right from all these ads, these phone calls, and unfortunately, some of them don't have somebody that can help them. So that's really what made me more passionate about getting involved. And now that guy happens to be my husband, Hector.
I was just going to say that guy who had the weird schedule is in this room, but It's not me or Josh. So, yeah.
At first, I was like, wait a minute. Who's the guy? Oh,
who's the guy?
It's me.
Yes.
So I've been doing insurance since about 2006 and focused on Medicare since about 2010. I fell into insurance. I got laid off from a marketing job back in 2005. Got my severance package and spent the holiday with the family and thought I'd gonna go out there January 1st and go get a job. And the only call I got was from an insurance company, and I just was not a big fan of insurance, but you got to put food on the table.
Right.
So got into that, found that I was good at retaining weird information, and that kind of gave me an edge, I think, out in the marketplace. Somebody would tell me they had a plan, and I would just know all the copays for that plan. And, why'd you pick that plan? So, and then other people found out that about me, so they would call me up for questions, and I eventually started up an agency, and now we're 41 plus agents, and we're covering 30 plus states and growing, constantly. And it's been a challenge, but it's exciting because, like Lauren said, a lot of these people don't have a voice.
Yeah.
So we're their voice. We're the pit bull in their corner, and we don't let our clients get taken advantage of. We watch out for them. We keep them informed, and I think that's the name of the game.
Yeah. Yeah, and that's really important, certainly with any insurance product, but especially when we're talking about Medicare as a health plan, right?
Yeah.
As a health, what would we even call that? It's like a group health plan, I guess, like the largest in the country or something of that nature. So,
I got to correct you. It's not a group health.
Okay.
So it's individual health, but it covers a specific group of people, yes.
Okay. All right. I'll let you have that one.
Yeah,
That's
because
fine.
group insurance is another thing.
Yeah.
That's true. That's true. Okay. So, because Medicare is only for a specific group of people, you have to be age 65. Is there an exception to that?
There is, yes. So if you have been collecting Social Security disability income for 2 years, you actually qualify for Medicare based on that.
Okay.
So you could qualify if you're younger than 65, and that applies to you.
Yeah.
That's another way. Also, certain conditions, you can talk about that.
Yeah, so ESRD or end-stage renal disease. It's something that you'll qualify for it after a certain number of months when the treatment starts. I believe it's 4. And if you have ALS, it's an automatic qualification for Medicare. It's something that, some people don't have the 2 years to wait.
Right, exactly. Okay, and that's really fascinating. So funny story about Medicare. I had last year. So the reason we're talking about Medicare in this episode is because your busy season is about to start, right? So the Medicare...
it started.
Yeah.
But Medicare enrollment period starts when?
October 15th.
Yeah. Okay, so we're coming up. We're taping this on the 7th, so yeah. You guys are like doing your stretches and you're getting ready.
Yeah, so October 1st is when we can actually start talking about it.
Okay.
So it's been
this
busy.
is good timing.
Yes.
Yeah,
so
perfect. Okay. So this time last year, I received a call, and it was a guy. I never answer random numbers, but I had so many of them. I was like, what is this? So I answered, and the guy's like, hey, just want to see if you've had a chance to look at your Medicare options. And I was like, no. And he's like, oh, perfect. Let's talk. And I'm like, let's not, because I still have 24 years to think about it, I'm not, he was like, oh, click, that was it. So, Medicare is interesting because we had to learn quite a bit about Medicare for the CFP curriculum, and that was on the exam. And so I would say that like the rest of my questions are going to be a bit about what I remember from that part of the curriculum, and also from what I've had clients ask about, or what I've experienced, or what I've heard the two of you talk about, because we've been friends for about, 5 years now? Something like that,
yeah,
right?
Since we were in Rotary together.
Yeah, so we're in Rotary together. During the pandemic, you two were my hiking buddies, and so we spent a lot of time together talking about Medicare, getting to know each other's businesses, all that fun stuff. So why don't we start at the top? Whoever wants to take it, or you both can take it, explain just kind of the basics of Medicare. There's a bunch of letters involved. They mean different things. Maybe start with what is traditional Medicare versus
Other options.
other options. Yes.
Sure. Well, original Medicare is made up of 2 letters, A and B. A basically covers hospital. There's more things in there. I would have brought a little slide had I known. But for the most part, it's the facilities, hospital. It's actually called the hospital benefit. And then Part B is called medical. So you can think of that as the doctors, the outpatient, stuff like that. Again, a lot more categories that fall under Part B and Part A, but to simplify it. Part D is easy. That stands for drugs. So all your prescriptions, although some prescriptions fall under Part B as well. So that can be a little confusing. Part C stands for Medicare Advantage. I don't know why they gave it Part C, but
Right.
it makes sense. And Medicare Advantage is basically the privatization of your Medicare. You're now getting your Medicare benefits through a private insurance company that has a contract with the government to provide those services. Medicare Advantage does come with some advantages and some limitations. A lot of those Advantage plans have extras that you don't get with original Medicare. Things like dental, vision, hearing, gym memberships, what others? Transportation.
Yeah, some have a food card, extra benefits like that, which can be really good for people on a fixed income. And most of them include Part D. So most Advantage plans will include that drug coverage. And then the other route that you can go is a Medicare supplement. So a lot of people will kind of get the two interchanged. They'll think if they have an Advantage plan, they have a supplemental insurance. They do, but it's a Medicare Advantage, because a supplement plan is actually a different kind of insurance. So
It's the way Medicare. It's the way the Center for Medicare and Medicaid Services defines supplement. It's actually a specific category of insurance, but our clients will interchange that word,
Right.
using it as, it supplements my Medicare. Supplement is a different. So whenever we talk about it, we get rid of the word supplement. We just say gap plan, because that's what a supplement plan is. It fills in the gaps with Medicare.
And basically what that gap plan does is, if you just had original Medicare would pay 80%, and the person would be responsible for that 20%.
So it's your co-insurance.
Exactly.
Yeah.
So there'd be no max out of pocket, no cushion, nothing. With the supplement, most of them will pick up that 20%. So
I once heard an analogy, and this is when I was going through the CFP program, where if you think about it as kind of like renting a house versus owning a house, right? And so if you're renting, you want to pay the least amount as possible out of pocket because you're not having to pay for repairs. But if you own the house, then you're going to pay more out of pocket, but you don't have to worry about some of the other stuff that comes up, right? Because it's all included or so. And I might be articulating that a little weird, but the way it was explained is that traditional Medicare or original Medicare with a supplement is renting the house because you may not have big health expenses to pay for throughout the year. So it's kind of like having a higher deductible on your healthcare plan or your, something like that. But if you have planned medical expenses or if you know that you're going to have things, then it's kind of like you buy it and you do a Part C. So is that, I have them reversed?
Reversed,
okay,
yeah.
thank you.
Yeah. So
All
somebody who's Plan C Medicare Advantage, it's pay as you go.
Uh-huh.
So if you don't have a lot of issues, that's been a very popular option for folks.
There we go.
Some folks don't like some of the restrictions, and we can get into that if there's ever a question about it. But the supplements are basically, it's either pay me now or pay me later. With the supplement, you're paying up front.
Mm-hmm.
The advantage of that is that you know what your expenses are going to be because it's already planned out. There's nothing above and beyond what's covered by Medicare and covered by the GAP plan, and then your premium. That's your expenses for the year. The problem is you pay whether you use it or not. So, the analogy I like to use is full tank of gas service, okay? You come to my company and I have a full tank of gas service. If you don't drive a lot, why would you buy a full tank of gas service where your tank is always full?
Right.
Yes, I don't drive. It's always full. I'm paying for this service and it doesn't do anything for me. But if you drive a lot, now you're going to get something out of that because I have to keep your tank full for the same price. So, or, you get a snowplow service and you live in the desert.
Right.
That means like I'm a healthy guy. I live in the desert. I don't need a soul. But if I lived in Flagstaff or I lived in, Alaska, now that's a lot of snow plowing. That would be like somebody who has a lot of healthcare issues. A supplement might make more sense.
Okay.
Because it's a fixed cost.
Also, with a supplement, any doctor that accepts original Medicare, they can go to any doctor that accepts that. So people that like that flexibility and don't want to think about a network or anything like that, typically, well, not always, but they'll end up going with a supplement, I would say.
Yeah, if they don't care about the advantages and they just want the flexibility and they don't want to think about it, it's a click it and forget it type of thing.
And is it, from my experience, it makes sense on an annual basis to review Medicare if you're already on the program to go ahead and review what you currently have in place based on upcoming surgeries and things that you might have or healthcare needs or whatever, because it might make sense to switch programs. Do I have that correct?
Yeah, for sure. It depends on what state you're in because if you run into medical issues, you might not qualify for a supplement if you started off with Advantage. So that's something to consider. I usually tell people when you turn 65, talk to somebody, whether it's us or another broker. Talk to somebody who does what we do, not your neighbor, not your dentist, not your doctor. They're all in their own lane. Talk to an industry professional because they can guide you one way or the other, or at least explain it to you so you can make a more educated decision.
Yeah. Well, and that's actually a really good question too, because when you turn age 65, there's a window that you have to make a designation unless you're still working and covered by a group plan, right, which we talked about.
Yeah.
Then you can get an exception, but if you don't file, then you get a penalty. That's lifelong.
Yes.
On your Part B premium.
And D.
Okay, right.
Yeah, so with that, that's a good point. People if they're employed under a company that has 20 or more employees, that's where they are able to delay Part B enrollment.
Mm-hmm.
If that company has fewer than 20 employees, they actually have to get original Medicare or they're subject to a lifetime penalty.
Okay.
So that's an important thing to know is that 20 employees.
And the parameters for the penalty are different for B and D.
Yes.
Okay. And so you should probably talk to somebody, isn't it something like 3 months before you turn 65 is when you should start actually exploring
Yep. Yeah,
and having that conversation?
Yeah.
Yep. Yeah, 3 months before is when they can start the process. And that's yeah, that's when I would recommend it. Some people want to know a few years ahead of time, and we always say, well, it's going to change because it changes every year.
Don't buy
Right.
it.
Yeah.
Well, and that's really interesting too, because speaking of the 2 years out, right? Your Part B premiums are a 2-year look back, especially if you're subject to IRMA.
Yep.
Right. So just for those keeping notes at home, IRMA is a couple years ago was a hurricane, but this year and every year with Medicare, it's the income related medical adjustment, or sorry, income related monthly adjustment amount, and so that has income brackets. So if you are earning at a certain level, you may have a surcharge on your Part B Medicare premium
And D.
And D.
and
yeah.
D. Perfect. So that's also very important to know, right?
It is.
What that's going to look like from an advisory standpoint, from a financial planning. That's something that I pay attention to, because how much income we're taking out of an IRA portfolio or something like that, or if they're going to continue to work, and we're going to try to bridge, especially if we're going to bridge that Social Security, full maximum amount, that very much could impact those Medicare premiums. So that IRMA surcharge is a very important part of, when you're in your 60s, there's a lot of things that you have to really pay attention to,
Yep.
income related, penalty related, things like that.
I would add,
ahead.
just one thing to that if people are expecting their income to change, since they do that 2-year look back, there's actually a couple forms that you can fill out and send to Social Security, where the Social Security will go on your projected income instead of the 2-year look back. So if you're retiring, your income might significantly change.
Yeah. And that's an important note too, because sometimes you have one-time events, like you need to say you need to buy a house, or you have to
be the other
pay, pay for something big. And so now you have a big withdrawal from your portfolio. When you have a withdrawal from your portfolio, especially if it's an IRA, that's going to be taxable.
Yep.
That's a big
You'd be-
influence.
You'd be surprised how many people we've run into that said, I didn't realize that because I took out $100,000 from my account because I wanted to buy this RV and my wife and I could
Yes.
go across country. And I'm like, you sell a property. Lauren just had that situation. You got to talk. If they don't have a financial planner, they should have one. Number
Right.
one, because
Agree.
they're going to guide you through that process. It's sad. I mean, we had a gentleman a couple years ago, retired from a very successful company, but he forecasted his income was going to be below the threshold for IRMA. When he got his letter for Part B, it was $500 and something. And he's like, oh my gosh, I don't even know if I can afford to do this. I didn't think it was going to be that much. We took the forms, we sent them in, and then the gentleman got approved for the $174.70. Actually, it was a couple years ago, so it was a different number. I think it doesn't matter.
Yeah.
But-
So that number you just quoted, that's the base Medicare Part B premium.
Correct.
Okay.
For this year.
Right.
Yeah.
We don't know what it's going to be for 25 yet.
Sure.
Yeah. They like to hold that.
Yeah.
Yeah. Hey, I don't know what the IRA maximum contribution is going to be for 25 yet, so that happens.
It's not like you have a job to do.
No, not at all. Planning? What's that? Okay, so how in the world, because Medicare is complicated, and because there are supplements, and because there are rules, and there are days in which if you have an event within this number of days up to like day 60, then day 61 to day 90 is this, and then day 90 beyond is that, and then you reach this mythical thing called the donut hole, right? Like, how in the world do you keep it all straight?
So for 2025, the donut hole is no longer going to exist.
Yeah.
So
That is the
good.
most confusing thing
It
in the
is.
world. It's
Yes.
and it's the dumbest.
It
like,
is.
the dumbest. I'm sorry, it's
Yeah.
the dumbest thing in the world.
No, I agree.
So yeah.
Yeah.
Well, that's not even the half of it. And I might go off on a little tangent.
Do
here,
it.
But
This is a safe space.
This is the issue, unfortunately, in a lot of situations where there's regulations, and I believe in regulations in terms of protecting the consumer. the
Sure,
individual.
absolutely.
But when
Because financial people are honest most of the time.
oh my gosh, same with insurance people. But when the government
Yeah.
gets involved with people making decisions about an industry that they have no knowledge about, and they say it's going to sound good if we lower the bracket to $2,000, and that's the max people are going to spend on their drugs, and let's all pat ourselves on the back, and that's great. It's helping a lot of people. The only problem is that with that, they thought they were dropping a pebble into a pond, and it ended up being more like a boulder the tidal wave of changes that had to happen because of that, that could be a completely different podcast altogether.
Yeah.
But it's something where there's a lot of changes, and if the people listening aren't talking to somebody, they should talk to someone, because just how the Part D has changed is the calculations are crazy. In fact, Lauren and I were confused by it, and I'm like, this doesn't make any sense to me. And I finally saw an article on it, read up on it, and saw a video of a guy explaining it basically in layman's terms. And I'm like, oh my gosh! Even tonight, we're doing a training for our team just to explain to them exactly how it works, but it's because there's so many people that don't get it.
Mm-hmm.
Well, I think something, I didn't mean to cut you off, but something to think about is the $2,000 cap. The insurance companies have had to take on more of the prescription drug cost. So because of that, they have to push that cost on to somebody, the consumer. So a lot of Medicare Advantage plans are seeing decreased benefits, increased co-insurance or co-pays.
Mm-hmm.
And unfortunately, this $2,000 cap really it helps a small percent of people, and that's great. It's a really good thing.
Mm-hmm.
But it also leaves out about 97% of the population that is not going to get any help because of this.
At least in Arizona, that was the demographic that it helps less than 3% of the people in Arizona.
You don't hear about that, though.
No. Why would you? I mean, that's especially in an election year. Are you kidding me?
Yeah.
Now, here's the question, though. If they're changing the Part D and they're lowering the max out of pockets for some of those people, are they then changing the formularies, meaning that certain drugs that people need will not be accessible under those plans? Is that happening?
So what you're going to find, and I think this is across the board, a lot of companies, and if you have a Medicare supplement, you're going to be more impacted by this because you have a standalone drug plan where that increased cost to the carrier has to be dispersed to that client, whereas with the Medicare Advantage plan, the increased cost on Part D, they're able to absolve some of that because they're getting, supplements from the government. The government's paying them on a monthly basis, but they are narrowing formularies. You'll see some drugs maybe that were, tier 4, maybe aren't covered now. You're going to see, instead of having co-pays, you're going to have a lot more co-insurances. And the way what you end up spending out of pocket can change dramatically from one year to the next, meaning 24 to 25. So I just sat down with somebody and talked to them a little bit about their plan. Ironically, because of the cost of their drugs, they're one of the people that are going to actually benefit from it. Although they are spending more on the prescription drug plan itself, they're actually hitting that $2,000 earlier in the year, and it's helping them. For other people, they're going to end up spending more just because the premiums alone have gone up.
Jeez. Yeah. Yeah. Okay. So when you're talking to people, I mean, as I said, as a planner, I'm thinking about things like Irma lifestyle. I'm thinking about, healthcare challenges. I'm thinking about income planning. I'm thinking about, longevity portfolios, those kinds of things. And when we talk about Medicare in particular, from a financial planning standpoint, all of those factors go into play. Plus, how much of this how much of your Social Security benefits going to be taxable? When do we take that? How does it impact Medicare? Right, all that fun stuff. What are some of the things that you guys are talking to people about and thinking about when you're giving advice or you're doing that consultation on how they should be selecting Medicare?
Well, for me, it depends on the state, because I'm in multiple states, and in some states, Medicare supplements are a guaranteed issue, so they don't have to choose to do a supplement. They can go with an Advantage plan and then switch to a supplement at the next enrollment period, or if there's a special election SEP period that they can take advantage of. In Arizona, the conversation's different. If you don't jump on supplements at age 65, then you literally have 1 year to still have that guaranteed issue. You can get an Advantage plan, let's say, and within a year, if you change your mind, you can go back and get on a supplement, and that's still going to be guaranteed issue. You've had people that's happened to. And then but there are some other loopholes in there that we have to educate some folks on if they're in a situation? Can you think of something else?
No, I think that's the main thing. But like the example that Hector was just saying, with a client of mine, they started with a Medicare Advantage plan and it was within their first year. And then unfortunately, that person got diagnosed with cancer. Now, to have an Advantage plan and cancer treatments are 20% coinsurance pretty much across the board with most Medicare Advantage plans. So luckily, not luckily that, the diagnosis, but because she was in what's called a 1-year trial rate, everyone has that for their advantage. And she was able to switch to a Medicare supplement with guaranteed issue. So for her, it saved a lot of money, you know?
Sure.
But that would be one example that you would, that we would recommend.
And so if there's no guaranteed issue, if they're past that window, what happens then?
Well, again, it depends on the state.
Yeah, it really does. Because some counties have such a low maximum out of pocket for Advantage plans. So sometimes the older people get, the more they're paying for that Medicare supplement, when really some Advantage plans might have a max out of pocket of, let's say, $2,500. So they could be paying more in their premiums to have a supplement, whereas if they had a max out or a Medicare Advantage and paid as they went, some here have a 0 premium in Maricopa County. So it really just depends, on people's needs, how much they're paying for that supplement. There's a lot of factors that go into it.
So for it being a national government program, why is it county by county?
Well, now you're talking about the Advantage plans. So the
And it's only the Advantage plans that are county by county.
Yep.
Correct. And then the supplements are by state, but they're regional. So you could have a supplement that has a regional price for New York City, a different price for upstate, and then another price for Western New York.
And is that just like law of large numbers kind of stuff based on?
I think it's the cost of doing business in those regions.
Okay.
They break them down regionally.
Okay.
But the like Lauren was saying, the Advantage plans with the low max out of pocket, as folks age, they typically travel less, and they usually see the same doctors, or they're within a certain group. So the need for that flexibility of I need to be able to go to anywhere and I don't want to be told what doctors I can and can't see.
Sure.
Sometimes that kind of goes away. And as Medicare Advantage plans have grown up or matured, they've eliminated some of those, concerns. Like a lot of the HMOs don't even require referrals now. So some of them have national networks, so you can pretty much go anywhere. But there are small things that industry professionals are going to know that the layperson wouldn't know. For example, the Mayo Clinic doesn't take Advantage plans. So if somebody says, I want to get an Advantage plan, and we start asking them, your doctors and prescriptions, I go to the Mayo. Well, you can just forget about that idea.
Sure.
If you want to keep going there,
there are certain stipulations to that, though, because if some,
there's always a cap.
the Mayo does take the Arizona State plan. That's a Medicare Advantage plan. So there's little things like that.
That's a retiree plan.
Yes, it's a retiree plan.
That's not open to the general public.
Arizona State.
Yeah.
Okay, so state retirees.
Right.
Correct.
Okay.
Yes. So there's a lot of little nuances.
Yeah, but what if I'm on Medicare and I want to go to Italy for a month?
Take us with you.
Yeah, Lauren, I know you probably can, right? We could both fit in a suitcase.
Yes.
Yeah, let's go. Hector, maybe me.
Why are you looking at my gut?
No, I think it was a short joke.
Could be. Wait,
Okay.
She's shorter than I am.
She's shorter than I am.
So with any Advantage plan, even if it's something that's a local HMO, you have worldwide coverage for emergencies.
Okay.
So,
Up to usually, what, 50,000?
it depends on the plan.
Yeah.
So if you're talking about a supplement, some supplements have emergency coverage outside of the country, and they usually cap it at 50,000. Some Advantage plans cap it, some don't.
And what would be? Is there kind of a stiff criteria for what is considered an emergency if you are overseas?
Well, urgent and emergency basically kind of fall into the same thing. So I usually use the example, you're ziplining in Costa Rica and you fall down and break your leg or something. You're going to go to the hospital. They're going to put you in a cast. They're not going to know Medicare, or you're going to pay with your credit card. They're going to take the $1,500, whatever they charge you. You're going to keep that receipt, and when you get home, you're going to submit it. And then depending on what plan you have, you'll end up getting reimbursed.
Okay. Okay.
So for the most part, there's
That makes sense.
things to keep. And, if you're really worried about it, I just tell people there's travel insurance. You can get it. It's fairly inexpensive for a short period of time. It's an extra added thing on top of it if you want to just have the peace of mind.
Mm-hmm. And is there anybody who wouldn't or doesn't qualify for Medicare? Is it just like an automatic, it's just everybody's going to be on it at some point?
You answered that. I feel like no. I mean, not really, other than you have to, you have to be a legal citizen of the U.S. or have a certain status.
For now.
For now.
Yeah.
Yes. And even that gets super messy.
Sure.
Because there's all these different statuses that, might qualify somebody to be eligible for Medicare. Working credits. So for Part A, premium-free Part A, you had to have worked at least 10 full-time years to qualify for premium-free Part A.
Yep.
A lot of people qualify. Or if their spouse worked that amount of years, they would qualify based on that.
Mm-hmm.
So there's laws like that come into play as well, especially when we have people from other countries here.
So let me grab that real quick. So that's a good point. 10 years of working credits, 4 quarters in a year, they say you need 40
credits.
40 credits.
Yeah.
So that's really,
Right.
that's how that, okay.
Yeah.
It doesn't have to be 10 years in a row, but
Throughout
over
your life.
working credits throughout
Yeah.
your life. Yeah.
Yeah.
And the reason they have the stipulation of you can qualify under a working spouse is because when Medicare first started, a lot of families were one income households.
Sure.
And, the housewife would stay home and raise the kids. And then how could they deny her the coverage when she was the one who probably had the harder job
Right.
raising the kids?
Right.
So, then, she would qualify under the working spouse's credits.
Yeah. Okay. Yeah, that's helpful because there's a lot of the same rules that apply for Social Security. So there's a lot of similarities there as far as how you qualify, when you qualify, who qualifies, all that fun stuff. So
You'd be surprised. There are some planners that aren't aware of IRMA. I don't know how, but and so we've helped some people with it, but it's good to partner with people like you because of that. And we have other planners that we partner with, helping their clients, and it's just good to have good people that we work with, and it's nice to find that there's other people that operate with a level of integrity.
a couple years ago, it's funny you say that, I had a financial advisor who had some credentials and letters and argued with me about the fact that income does not impact Medicare Part B premiums. And I was like, you're
Misinforming your people.
you're wrong. And they're like, no, it does not impact. I'm like, gee, you're an advisor.
Yeah. Under the mattress, income doesn't count, but everything
Yeah.
else.
Yeah, no, so it's really important. It is important to work with professionals because that's the thing I always say, not to get on my own soapbox because it's easy to do it, but it's like you can work with somebody who has a job title and is ready to sell you something, or you can work with a professional who's ready to advise you on what's in your best interest because of the things that are happening in your life. And I think it's important to find, likewise, people who care about who they're sitting in front of enough to say, if you're going to do this, or if you're having this kind of situation, you should do this instead. This over here might be a little more sexy, but this is going to be the better way to go. And I think that's really important. So we talked about the open enrollment period. We talked about the October 1st. You can start talking about it. I know through experience that there are people who violate those timeframes.
Oh, yeah.
Okay, so talk to me about how that happens, because there's probably been people who might be listening to this, or they might send it to somebody who is Medicare age, who's probably been called outside of those barriers, or been marketed to outside of those timeframes. So how does that work? Why is that important? Why is that October 1st to December 7th or what?
Yeah.
Why is that time frame so important, and why do those rules exist?
So legally, everyone should ask themselves when they receive a phone call, did I give anyone permission to call me? Did I fill something out? Did I click on something? Did I do anything
For Medicare purposes.
for Medicare
Yeah.
purposes?
Okay.
Because
Can Can I stop you real quick?
Yeah.
So it's important with that even if you filled something out wondering like what your medications or doctors, and you put your phone number in there or your email, you're probably giving them permission to contact you without even knowing it.
They're gonna, yeah. So when you do that sign up form, you have to check the box that says that you agree to be marketed to.
Correct.
Basically,
Yeah,
yeah. But I think some people just kind of click through it to get the answers.
Sure.
So
Sure.
go ahead.
So that situation, obviously, but if they haven't done any of those things, because this is still happening, there are companies that are overseas that are making phone calls, cold calls to seniors at an alarming rate.
41-year-olds.
Yeah.
last
Oh,
year.
41 years.
Oh, I
Yeah.
get
Yeah. I mean, I'm almost offended. I didn't get one. So
Sorry.
But at
Hey,
an
I've been
alarming
on
rate.
I've been on the AARP mailing list since I was 30.
Oh no, we get that list.
Yeah.
You got mad that you were on that
Yeah,
list,
I know.
but it's because we sold it.
I also got hearing aid. I've been getting hearing aid things for
What's that?
for probably like 10 years, and I swear somebody like
It's Melissa.
I think so. Somebody. It's probably like, oh, he's a drummer. He's gonna need these, and so like somebody put me on that dang list like as a prank, right? So,
Oh, yeah.
Sorry. Go ahead.
No, that's okay. So now I've lost
The
my train of
overseas
thought. So the overseas incoming calls, and what happens is we're not allowed to do an enrollment unless it's an incoming call, right? So the overseas parties that are not subject to the same rules because
And that's at any
overseas,
time in the year. That enrollment can happen
they have
any
been
time of the year.
doing this for years. They have been doing this for years. They will make a phone call to a senior. Once they get somebody who's sounds like they're interested, they transfer it to another company. Now, as
It's
the
an
company,
inbound call.
It's an inbound call. It's on a recorded line, and they'll talk them through and say, I'm trying to find out if I qualify for this $2,000 that I can get back, and what ends up happening is they find out that they don't have Medicare and Medicaid, and they'll say, well, you don't qualify for that program, but you do qualify for, and they'll try to swindle them into another plan because they get paid to enroll people. The difference is all of those calls like that, they're all transactional.
Mm-hmm.
They get you now, they sell you now, you will never talk to that person again. And I've literally had clients call me up and say, I don't know what I did. I got a letter from my insurance company saying that I'm being canceled and I haven't gotten anything else. I found out after doing some digging, she had accidentally enrolled in a plan that really wasn't in her best interest. And we ended up having to switch her back. But she got a random call, had a conversation with the nice person, they got transferred to someone else, enrolled in a different plan, and it happens all the time. And it's illegal for us to do that. But think about it. If you have a relationship with a broker, like, you're working with us or another industry professional, we're not going to have some random person call you without, you're going to hear from us first. I might say, hey, Dale, I'm going to have Lauren call you because I'm not going to be working in that area and she's taking over some of the, I'm never just going to randomly have somebody call you. So when people get those calls or they call Joe Namath or J.J. Walker, they're really getting themselves into a situation that their information is going to go out to everyone and their brother and, be on the lookout for getting swindled.
But those enrollment calls can only happen between October 15th and December 7th, right?
Not always.
Okay.
So throughout the country, there are special election periods that happen because of FEMA disasters, because of migration, because of gun violence. There's 20 or 30 of them at any given time. In Arizona, wildfires.
Sure. So so does that mean we're expecting to see them because of the fallout of Hurricane Helene?
Most likely. Yeah.
Absolutely.
Yeah.
Every single one of the, once they get cell service up, they're going to get phone calls. Hey, you got your Medicare. We're going to have to look at something. It's going to happen across the board. It's very sad.
Sure. Well, and probably later this week in Florida too, and hurricane, what's that hurricane called? Whatever.
Milo or something?
Something, whatever it is.
I can't remember.
Yeah.
Which one is it?
No, the one that's
Helene, and it's like the next one. They skipped a few letters.
Did they skip?
Yeah.
Yeah.
I think it's like a Milo or...
Yeah, whatever it is, it's currently out in the... It's
on
out
its
in the
way.
Gulf.
Yeah,
It's
we have
on
an
its way
agent
to
in Florida who
Yeah.
said, hey, we got another one coming on Thursday.
Yeah, pretty brutal. Okay. So, all right. So you've got the open enrollment period, special election periods. Milton.
I knew it was
Milton.
something. Milo, whatever.
Fancy.
Yeah.
It's a fancy name.
There's another one. Keep going. Special election.
Yeah, and then when you turn 65.
That's your initial election.
Okay. What am I missing?
There's the Medicare Advantage open enrollment period.
Okay. Explain that.
It's only open to people who have Medicare Advantage, and it runs from January 1st to March 31st. They're allowed to make one change. So there's a lot of seniors that don't get, they don't want to make changes.
Mm-hmm.
They want to keep what they have. They might not read the information. January rolls around, and then all of a sudden they find out a doctor's not covered, a medication's not covered, the cost is dramatically different, and oh no, it's past December 7th. What do I do? They have one opportunity to make a change. As brokers, we're not allowed to market that as an opportunity, but we can inform people of the different, times they can change. So if somebody falls into that range, they can. Another one that happens, a special election period happens when your plan is sunset or discontinued or eliminated from one year to the next.
Yeah.
Normally, you can't enroll after December 7th. You can't make a change after December 7th. But if your plan is being sunset from December 8th until December 31st, you can make a selection for January 1st. If you don't, you are automatically put into original Medicare. But then you still have 2 months, January and February, where you can make a selection to pick a plan, and then it doesn't start until the following month. So if I pick in January, it starts February 1st.
So this is like I'm on plan L and it's closing, and
different scenario. That's a Medicare supplement.
Isn't that what you're explaining? Like that plan's no longer going to be offered?
No, Advantage plan.
Oh, okay.
Yeah, so Advantage plan, X.
This is why you're sitting
Which
here.
this year there's been a lot of disruption, and a lot of Medicare Advantage plans are leaving the market because a lot of them got lower reimbursements from Medicare, which is affecting a lot of that as well.
Yeah.
There was a big one last week with Humana.
Yeah.
Humana was downgraded. They were given a 3.5 by Medicare, something like that.
Mm-hmm.
So that's been a problem. Their stock went down 22% on that news.
Wow.
It all depends on
It's
how
crazy.
leveraged they are.
Yeah.
There are companies that are less leveraged in the Medicare market because they're diversified, which obviously I know that you'd tell people that don't put all your eggs in one basket type of thing.
Uh-huh.
But yeah, there are plans, and I mean, I won't say what the plans are, but they already know they're pulling out of enough areas that there are across the country, just with one plan, over 500,000 Medicare people that are going to lose their plan.
Why are they pulling these? Why are they pulling out of the plans?
They can't afford to administer the plan in that area. So they might pull out of one county because that county they can't afford to do it in. Or they might pull it out of several counties or part of a state or an entire state altogether. It all depends on the plan. It all depends on the reimbursement. It all depends on the cost of doing business in that area.
Okay. And so just so that way I'm clear, the listeners are clear, when we say that they can't afford to operate plans in that area, this is a government-funded thing, right? And so they can't afford it because there's too many claims on the insurance, because there aren't enough providers who will take Medicare reimbursement. Or
sometimes
take
it could
Medicare.
sometimes it could be market driven in terms of there are not enough providers to have a network. But typically what ends up happening is the way Medicare Advantage plans are paid, people say, well, wait a minute, how can it be a zero premium? There's no such thing as a free lunch. They're getting paid. What they get paid is determined on your medical history, which is why the plans always want to send somebody to your house for an hour so they can look through every single thing on a list of 5,000 conditions, mark them all off, and then the reimbursement to the carrier goes up, right? Because it's based on your medical history. So let's just make it a round number, $1,000. So Dale has a Medicare Advantage plan. That Medicare Advantage plan gets paid $1,000 a month to administer your health. Now, you never use it. You're healthy. Everything is great. They love you because they get $1,000 a month whether you use it or not.
Sure.
Now,
That's just like any other insurance plan, period.
exactly.
Right.
Person X has, $500,000 surgery. The government's only paying them whatever the health history is based on. Let's say maybe they get $3,000 for that person, but that's all they get. So if they have $1 million bill and they're on the hook for that, they have to have enough Dales in the mix to be able to make up the difference. And then when they can't, they have to adjust the premiums and benefits the next year. And
For
then
everybody.
They have to take into account the reimbursements.
Yeah.
And then when it gets to be upside down, they pull the plug and they jump ship.
Yeah.
But that's where it gets messy too, because then you have like the chronic special needs plans where these Medicare companies, Medicare Advantage plans or companies that administer that, get paid more per member per month based on chronic conditions.
Mm-hmm.
Yeah, the sicker you are, the more the insurance company gets paid to have you on board. But they're not allowed to cherry pick healthy people to help offset the sick people. So it is kind of funny just the way it works, but they all get paid. There's lots of money in the system.
Yeah.
But the system is also wrought with fraud.
Well, also,
sure.
Didn't the Inflation Reduction Act have a lot to do with Medicare in general this year, though? Because I believe $700 million less reimbursements throughout the whole industry.
Across the board.
So it had a huge impact.
Well,
that
that
they make it harder to qualify stars wise. So plans get reimbursed based on their star rating.
yes,
So they downgrade a star rating, they get less money.
right.
But as they raise the bar on the star ratings, less companies are achieving that higher rating.
Sure.
So they're seeing cutbacks there as well.
Yeah, the Inflation Reduction Act is poorly named. It is exactly the opposite. If you actually look at what it's done, it's done exactly the opposite of its name, and that's just my opinion.
Well,
But that's also fact. That's also fact.
It's kind of like the house painting project when all you're really doing is putting in railings and putting in pavers. It's got nothing to do with painting the house.
Right.
That's basically what it
Right.
is.
Well, in the government now, they're subsidizing these Medicare Advantage plans because they have realized the impact on their
There's
loss.
a juicy story there, Dal. Literally, as these companies were submitting their claims or submitting their bids, okay, they have to bid every year. The government said, whoa, why all of a sudden have these Part D bids gone through the roof? And they said, well, we're getting less money, and then now we have to take on more responsibility for the cost.
Right.
So the $30 premium is now $170. And they said, no, we can't do that. It's an election year.
Yeah.
You know, we can't do that.
Right.
So now the government is subsidizing these plans to the tune of over $100 a month. So, you know, Inflation Reduction Act, who's paying for that subsidy?
Yeah.
All of
Yeah,
us.
that's the thing. It's like if you've ever played with, this is the best thing in my brain that I can think of right now is like, if you ever played with like a squishy toy, like a baby squishy toy where it has liquid in it, where if you squeeze one side, all the liquid goes to that side, and you squeeze it, it goes that way. Yeah. That's like the push and pull and the cause and effect that I think most politicians don't think about when they come up with these great ideas. They don't realize that all that's going to do is move. It's a shell game. It's just going to move the cup this way. Or whatever you want to use for that analogy.
Keep kicking the can down the road.
Yeah, or just over to the side, and then it's going to have an impact on somewhere else, right? So, like, great thing with insulin. So we capped the cost of insulin, but all that does is move that number somewhere else, and we still end up paying for it.
Yeah.
Yeah,
Absolutely.
Okay.
There's multiple podcasts.
Well, yeah, I was just saying we probably could keep going with this, but in the interest of time, maybe we can put a pause button on that, and maybe we can do this again after the first of the year when you guys come back from, because you're not going to get any sleep between now and December 7th probably. So
No, I go into vampire mode.
Yeah.
oh, perfect time of year for that.
Yes.
Love it. Okay, so anytime that we talk about things like Medicare, especially, all it does is raise more and more questions. So people are going to have questions. How do they get answers? How do they get in touch with the two of you? What's the next step? How does the process work? Go.
Well, we have a website, desisagency.com, and that has all our information to contact us,
Okay.
phone calls, email. I think that's the easiest place to find all of our information, or they can ask you because you have our information.
Well, and we'll put that in the show notes of the podcast as well, that website. So, and it's Dessis. You can see it on Hector's shirt maybe. I think that camera probably can see it. Yeah, DESSIS, agency.com.
Yeah.
And so they go there. What happens?
I mean, they can submit every one of our agents has a form on there if somebody's looking for a specific agent. We also have a general form. So if they want us to reach out to them, they can just fill out the general form. I'll give them a call back, usually within 24 to 48 hours. Happy to answer questions over the phone. If they want to have a consultation, obviously we've got 40 agents across the country. Any one of us could help them out. And a lot of times we'll get a call from somebody who's hesitant to talk to us because they don't want to sign up for something. We don't need to sign people up. You know what I mean? We're happy to help whoever we can help. And more often than not, like just recently, Lauren set up a situation with a group here locally where we're the resource. So when they have a question and they have a population that they serve, they just use us to be able to answer questions in a way that they know they're not putting themselves in hot water, but collectively we're still helping the end user, which is their client. So we don't necessarily need to be directly involved with the client. When you have an issue, you call us, we give you the information, you relay it to your client. If they want to talk to us, great. If not, that's fine.
Yeah, and we've done that. We've done that several times.
Our partnership is with you. So, yeah. And we're happy to be that back office for you when it comes to this regulation.
Yeah. Okay.
Yep.
Perfect. Anything else that anyone, you need to know this before we sign off the podcast about Medicare other than the dates and anything else?
I usually tell folks, don't panic. I mean, you have until December 7th. Nothing irks me more than to spend a bunch of time with somebody. Listen, we're happy to help, but we also get compensated when we help you if we facilitate an enrollment. So there's times where we'll help people for months going back and forth communication-wise, telling them what they need to do, and then they end up, I just signed up online. Well, why would you do that?
And just to clarify how we get compensated, it's not by the people we're meeting with, it's by the company that they choose to go with. And all those companies legally have to pay us the same. So we're really we're not steered in any direction. It's truly what is best, for that client. So I think that's important to know too, is we're the middleman. It doesn't cost people anything to meet with us. Yeah. We just facilitate the enrollment.
The thing about it is it's not a transaction. The people over the phone, it's transaction because they never see you again. We're in it for the long haul. We want the relationship.
So you want to see them year after year. So when Medicare open enrollment comes in, you want to be meeting with them or having a conversation and reviewing.
Yeah.
And sometimes the conversation is, don't do anything. What you have is fine, even if it's not something I enrolled you in.
Yeah.
And if you're already in the best plan, I'm not going to switch you.
And you've done that for me. I mean, with one of my clients where you've in the last 5 years, you've met with her twice and both times told her don't change anything.
Yeah, I know exactly who you're talking about. They got a great plan from retirement.
Right.
Doesn't
also,
make sense
if people
to change.
have issues that come up throughout the year, which they will eventually, they can also call us then too. So, and it always is good to be that person's broker, because then we can advocate on their behalf, and we get a lot more flexibility by having that title as the agent of record.
And I think that's helpful too, because you speak the same language as the insurer,
Exactly.
and the average client does not.
Yes, it's a whole nother language.
Yeah, it is.
They have to come through the front door. The client has to go through the front door, and the office hours are 8 to 5, Monday through Friday. We have a key to the back door, and we can access management when we need to. And a lot of times things do happen a lot faster. We can escalate things. And like you said, we're speaking the language of both parties. So as that interpreter, sometimes things get lost in the shuffle. It's nice to have an advocate to be your voice.
Yeah. Very good. Well, this has been a helpful conversation on a very complicated program. Again, if people have questions, go to destisagency.com. You can always go to lifemoveswealth.com, and I will put you happily in touch with Lauren and Hector. And of course, any of their agents in your area, and I know that you'll be in good hands not because we're friends, partly because we're friends, but also because, as I said, I've had clients who have been helped by these two, and they've done really well. So I think that's it. Is that it?
I guess so. Yeah.
Awesome. Yeah. All right. Well, thank you again for coming on the podcast.
Appreciate the invite.
Yeah. Thanks for having us.
So glad you came. And until next time, or until the next episode, go be financially awesome. Take care.
Bam.
Thanks for listening to this episode. Be sure to like, subscribe, and share. To learn more about your financial purpose, visit lifemoveswealth.com.